a very warm welcome, Greg. And I am so happy to get in touch with you, connect with you and 18 Loop. So for all of our audiences who will be watching this, we have Greg Tarnacki with us, who's the CEO of 18 Loop. And this organization is very not very renowned, but I would say doing a great job in whatever they do. So I will not take that moment away from Greg, and I'll ask Greg to introduce himself and tell something about 18 Loop to us as well. Greg.
My name is Greg Tarnacki. I'm the CEO and founder of 18 Loop. We are a 501c3 United States nonprofit, and we are a Fast Company Magazine Honorable Mention World Changing Idea 2021, which we're very proud of. We focus on advocacy for the use of virtual reality or VR for kids with cancer, research and technology distribution. So we're focusing on getting VR headsets to kids with cancer. And we're planning on developing our own multiplayer collaborative environment later this year. We are currently doing joint research with the American Childhood Cancer Organization, which is the largest grassroots cancer advocacy organization for children in the United States. And we do a joint research study with them. And in that research study, our kids are using VR, and we're testing the efficacy of virtual stress management to help them to tolerate their treatment, recover, and thrive. And we're very excited about the results. We get 91% of reporting a mood improvement. So it's a great thing. The kids that use the technology really love it, and we're getting wonderful results from the early research, which is positive. We've also discovered several things about it. So number one is that gaming is very positive for children with cancer, because when they're undergoing chemotherapy in a hospital, they need to be physically active, and that physical activity helps flush that chemo drug out of their system after they receive a dose. And so the physical activity of gaming has been positive. Virtual stress management itself has increased mood, so it's a better mood improvement for them. And also we found that it's a family intervention. And so as kids get VR from us, their brothers and sisters and mothers and fathers use it as well. And that's so important for the overall mood and the health of the family. And family intervention in and of itself is very important to us, because doctors and hospitals and palliative care physicians look for that type of intervention to benefit the family holistically. And so it's a great thing. So all of that is in our favor. Some of it we've discovered along the way, some of it was planned, but in general it's been very positive.
Wow, very interesting and amazing idea that you came up with. Actually, I wanted to ask, but I think you gave my answer in your last statement itself. I wanted to ask that how virtual reality is actually creating an impact in the lives of all those children who are suffering from cancer. But I think you very well explained how is that creating an impact, and along with the numbers, that is very enthralling and very exciting to see that how technology and gaming can actually be used to help children cope up with their stress and the stress of the disease that they're dealing with. And here I also wanted to understand from you as well, like cancer has been here amongst us for a long time now, but still the awareness about cancer in the society is fairly low as compared to if we consider the time that it has been amongst us. So I would like to understand from you as well that why is cancer awareness so important in today's era itself?
I think cancer awareness is important for a bunch of reasons. Several are early detection, and also the curbing of negative behaviors. And so when you're dealing with cancer, 30% of it, or about 1/3 of it, can be prevented by modifying behavior. So you have to know what those behaviors are and deal with them in order to deal with cancer. And so those are things like low fruit and vegetable intake, the use of tobacco, the use of alcohol, lack of exercise, high body mass index. And there's some elements around industrial exposure and stress of certain types of economic behavior. And so it's very important for people to understand what they can do to prevent cancer, but it's also important to understand what can be done to treat it. In the developed world, about 90% of countries have the ability to treat cancer from beginning to end. And in the developing world, it's only about 15% of countries. And so there's a very big gap, and there's a gap and a distinction between the developed and developing worlds in terms of how cancer is treated. So when you look at it on a global basis, there's a long way to go. And in order to address that, you have to raise awareness so people understand what can be done.
I think very well put, and I would like to agree with that. And I would like to add to that in countries, developing nations and underdeveloped nations, like even in India, where we are currently located at, there is a lot of taboo associated with this particular disease. Okay, that you cannot tell people that you have cancer, and people do not even go to check themselves out medically, check themselves out that if they have cancers, because they have a fear that if they will go there and cancer will be detected, they will be doomed, because that is a taboo in our society. So I think there are a lot of such, like, it depends upon the geography as well, that what taboo do you associate with that particular issue that you have. So I would like to understand from you as well, there are a lot of misconceptions, a lot of myths, a lot of false information that people have about cancer in particular. So I would like you to throw some light and bust all those myths and misconceptions and false information that is prevailing in our current society.
Sure. Well, I think that there's a couple of things. And so one myth might be that you can't develop cancer from a communicable disease, but you can. Hepatitis and human papilloma virus cause a large number of cancers in low to medium income countries. And so there are communicable diseases, a disease that you can catch. And so these are preventable through vaccinations and treatment. And so it's important to know that you can develop cancer from something that's not hereditary. And so that's an important thing to understand, because it promotes behavior and promotes people getting inoculated so that they can combat this type of thing. And so I think that's a very important aspect of it. And I think also some people think that there's nothing that you can do in terms of behavior, like we spoke before. And I think the behavioral aspect of your life is something that people do have a large amount of control over, definitely some control. And to make sure that in the developing world, well, for years, to step back a moment, for years, cancer was more prevalent in the developed world, and it was more prevalent there because of behaviors, tobacco, alcohol, all the things we talked about before. And now, as the developing world is catching up and more people are adopting those types of lifestyles, it's really a matter of urbanization and a change in dietary habits. And when you put all those things together, it creates a risk. And so one of the statistics that I looked at, I was brushing up on some statistics before I spoke to you, and that is that the cancer rate is accelerating. It's grown by 73% in developing countries, while only 29% in developed countries. And so the developing world is at great risk. And I think these misconceptions about not being able to address it, how you can catch it, how you can combat developing it, are all very, very important.
Wow, I think those were some very, very insightful and relevant information that you just shared. And I think, again, you answered my next question as well. I was about to ask that, is there any difference in the cancer rates that we see in developed and developing nations? So I think you very, very peculiarly mentioned that there is a significant growth in the cancer patients in developing nations as compared to the developed nations. So now here I would like to understand from you that, is it something that we ourselves have brought upon us? Is there something associated with our changed lifestyle, changed behavior that could be one of the reasons for this particular disease and the alarming increase rate in the developing nations?
Sure, I think it's a change in economies, and it's a change in the way people earn money. It's a change in stress. And so when you look at alcohol and tobacco, those are typically used by people to combat stress. And so when you introduce a more urbanized, more industrial type of society, a more capitalist, urbanized, industrialized society, when those elements are introduced, people tend to rely on different ways to relax and combat stress. And so as the developing world grows, what comes with that, some of what comes with that is industrialization. And with an industrialized society, you start to see people getting bad habits around, how they eat and what they put in their body and what they do. And so I think that we have to be careful, because I think economically, industrialization and technology promote a better lifestyle in terms of monetary life, but in terms of your actual health, it doesn't always immediately promote great health because of the habits that people pick up to deal with the stress and pressures of working in an industrialized society. And so knowing that, it's important to educate people who are in developing nations so that as they participate in this new world, they also are aware of the risks.
Wow, I think that couldn't be put any better than what you just said. And here I would like to move ahead from this topic and talk about another aspect of this particular issue that we're facing in our society. So like we earlier talked about this, that there are a lot of misconceptions, a lot of myths, like you busted a few of them, and a lot of prejudices, a lot of taboo associated with this particular disease. And whenever there is a myth prevailing about a particular issue, the society is always involved in that, because it is the society that is creating that taboo. It is the society that is creating the myth. It is the society that is creating and following those false information and misconceptions, right? So here, for this particular issue, I would like to understand from you as well the role of the society here, because people live in a society, and what society thinks of them, what society thinks of their disease, what society thinks of their challenges means a lot to them, and it affects them mentally more than physically. So there is a mental aspect related to cancer again as well, and society can be a big reason for that. So I would like to understand from you again the role of the society in this particular issue.
Well, I think it comes down to awareness again. We're talking about awareness before, and awareness is so important. And so there's probably a disparity or a difference between the developed and developing world about how society looks at cancer as a whole. And there is certainly a very big mental impact for cancer. And so when you're looking at palliative care, you're looking at doctors who are treating not the disease itself, but the impact of the disease on you. I think that's an important area to look. And so for us, we deal with children's cancer, so we're dealing with pediatric cancer. And we're trying to address just that. I mean, we're introducing virtual reality technology, or VR. You have an immersive headset. It controls what you see, it controls what you hear, and you can present a meditative environment for meditation to help people relax themselves and relax their mood, which is very important. We deploy a technology called TRIP, which is a company out of Los Angeles, California. And TRIP, TRIPP, is a wonderful software that in a virtual headset, in a Meta Oculus Quest, or in another virtual VR headset, it's a very good for helping with mood. And so we see with our kids that helping mood helps the overall fight against cancer. And I think societally, to deal with the pressure that society and the disease puts on you, this is a very positive thing. So from my perspective, I like to focus more on what we do, and what we do is deploy VR. And I think we see this being very effective with children as a family intervention, and individually with children, but also it can be very, very effective with adults as well. And so, I think there is always that gap between developed and developing world. And I think that taboos are different, but what we choose to focus on is how you cope with that yourself. And we do that through virtual meditation predominantly.
I think that's a great way, and I loved your approach, the approach that you're taking, because this is something that children can actually relate to. And doing meditation is very, very important, and compelling children to do meditation, I think it is very, very hard. But I think through virtual reality, we can definitely explore that way for children as well. So thank you so much for that. And here I would like to discuss about another different element, and specifically focusing on your non-profit organization. So whenever we had a conversations with a lot of non-profit organizations before as well, and whenever we talk to a non-profit organization, they all unanimously say that when it comes to the biggest stakeholder in a non-profit organization, it is volunteers straight ahead. it is the volunteers, because a founder, a CEO cannot take the organization and the cause to another level without any support. And since it is a not-for-profit organization, they don't have ample budgets to hire full-time employees and everything. So I think volunteers play a very, very crucial and very, very important role in a non-profit organization. So here, from your non-profit's point of view, I would like to understand that what has been basically your interactions with your volunteers, and what are the different areas where someone, let's say like me, who's sitting in completely different geography, different part of the world, who has that eagerness to come up and support your nonprofit, who's willing and who has some kind of abilities which can actually be useful for your nonprofit organization. So how can someone like me come up and support your nonprofit organizations? What are some different ways?
Sure, absolutely. A couple of things. First of all, I did a year of AmeriCorps. And so in AmeriCorps, I worked with a lot of volunteers. I trained volunteers. I ran a program. And after that is when I decided to start 18 Loop. It was about 5 years ago. And so I'm familiar with the volunteer process, training them, working with them, and the importance of them. And as you said, they're very important. They're very important to every nonprofit organization. The first thing that I would say is that 18 Loop is a volunteer organization. So none of us are receiving a paycheck right now. We're all volunteer, and we are a board-run organization. And so our board members run the company, and they're powerful people that have important day jobs, but they make the time for 18 Loop because they believe in the cause. So that's very, very important. And I think from, at least in the short term for us, there are a number of ways that you can get involved with 18 Loop, but one of them is that we're going to be introducing a virtual race that we're co-sponsoring with the American Childhood Cancer Organization. So we'll be running for childhood cancer. So International Childhood Cancer Awareness Day is on February 15th, and in March we will be doing a run for the ACCO. So we're looking for volunteers to help raise money, and a lot of what we're looking for is multiplying or increasing fundraising capability because it's expensive to get those VR headsets to the kids. And so we have an ambitious goal. Just so you know, there are about 16,000 children in the United States that get diagnosed with cancer each year. And globally, it's about 400,000. And so if you were to get all of those kids a VR headset, it would be a great benefit, but it's also very expensive to deploy that type of technology. So a lot of our volunteering, what we're asking from people who partner with us is to go out and help us to raise money. And so our race is called Run Loops Around Cancer. And Run Loops Around Cancer will be run in March, and we're looking for all kinds of volunteer support to recruit runners and to raise money for the company, because we want to get our next round of VR headsets to the kids.
Amazing initiative, Greg, I must say. And this is like, I have been consistently saying that this is a very, very interesting approach that you're taking, and very different approach as well, because a lot of non-profit organizations focus on how they can assist the children, the patients who are suffering with such kind of disease, with some kind of empathy and other kind of resources like medical help, mental help. But this is a completely different approach to tackle and address a particular issue and a disease. So I think this is really, really amazing. And I think those were all my questions. I think there were several of my doubts as well, but I think you so wholesomely answered all my questions that all my doubts also got covered within that. But before ending this amazing, insightful conversation, I would like to ask from you. I would ask you to share a message for all those potential volunteers who will be watching this video, telling them that how their bare minimum effort, their bare minimum contribution can create such a huge impact in society, in the lives of all those children, and in the initiative of your organization as well.
Well, what I would say is that children that develop cancer take 1,000 days to heal, and many of them don't survive. I mean, in the United States, it's about an 87% survival rate, so maybe 1 in 5 don't survive, and it's a very hard, long journey. VR makes it easier for them, and as a volunteer and as someone who supports 18 Loop, you can support us helping their mood. Better than 9 in 10 children report better mood with our VR. And actual pediatric oncologists feel that VR is very beneficial to the kids in the hospital and at home. So considering that we're helping them and their families, any effort that you can do for us, anything that you can put forth for us, is so helpful to improve the lives of the kids and their families as well. And so we're just asking for people to come and support 18 Loop. Like I said, we're a volunteer organization. We're looking to raise a good amount of money to distribute the VR. And as we multiply this, the more kids we reach, we're just going to multiply the benefit. So we're very excited about that.